So there is kidney cancer and there is urothelial cancers, and the kidney cancers actually is the more common part is the kidney parenchyma cancer. However, there is the renal pelvis and ureteric cancer, which is another group of cancer that we call it the transitional cell carcinomas. And these cancers are the less common one. And the challenge is that when you have a common disease, you know more about it. When you have less common disease, your experience is less. And here comes the challenges. And for urologists and uro-oncologists and medical oncologists, it's always nice to have this kind of knowledge to exchange experience between different colleagues and to understand more about the disease. And every team should have this kind of exchange of knowledge, which at the end enhance the medical field in general. So I'm talking today about what we call it upper tract urinary cancers, and these are one of the maybe less common cancers in the kidneys and the ureter. We're today planning to discuss some of these scenarios that urologists and medical oncologists and uro-oncologists can face up. We're going to highlight how to deal with these challenges, different technique, new technologies, using the endoscopic approaches, using the percutaneous approaches, and even using the robotic as well. And we're hoping at the end that we'll have an exchange of knowledge between myself and the colleagues in the same field. So understanding what we're dealing with, and the problem with less common diseases, that the more common you have, the more knowledge you have. The less common the diseases, the less experience we have. But getting experience from yourself and other people and putting all these experience together always end up in more benefit in the patient side. So you get more benefit in the patient side. There is always updates. There is always trials going on. We are going I'm going to address actually some of our current data, especially using the laparoscopic approach. I'm also talking about the robotic close technique, which is used by my colleagues who does robotic surgeons, and talking about their early results, which have proven efficacy in minimizing the recurrence rate of this tumor into the bladder. Also, we'll talk about the value of adding installation of chemotherapeutic agent in the bladder and the timing of adding these chemotherapeutic agents. All this will be discussed today in my presentation. We are always heading to the direction of how to early diagnose this cancer, how to use minimally invasive technique. And early diagnosis is by raising the patient's awareness, getting the media, like people like yourself, to address all this to the patient, explain how they can diagnose these cancer earlier. The earlier the cancer diagnosis, the much easier for us to deal with it. And also using the new technologies, using the laparoscopy more, with all these evolvement in the endoscopic field. The vision is better, the diagnosis is better. All these new technologies in the CT, in the MRI, all the scans have been very helpful. So we can recruit this always in the benefit of the patient. And at the same time, we are in the era of robotics, and we have always to look at this side, how to make the patient life easier, the discharge or hospital stay less, getting the patient back to home and to function quicker. All of this very important.